Hope Channel, changing lives.
Welcome to the program Wounds of the Heart. We are so grateful to all our viewers for being and sticking with us since this inception of this program. Today I have a wonderful gentleman who is going to grace this talk with his expertise in what we call addiction. But just before then, I just wanted to know that this program is live on Hope TV GH Facebook page and also YouTube channels, Hope TV GH. So you can click on the subscription button and share the link to other people also to hook on to Hope TV, because there are a lot of things that this station brings to you or to your doorsteps. I'd also want to acknowledge the fact that Alpha Art is the one who always put me on flyer. Alpha Art is on Instagram, it's on Facebook. If you need Alpha Art, just go to Instagram, just go to Facebook, Alpha Art. And he's good in graphic designing. And another gentleman called Afri Studios is also into photography and also videoing, editing and stuff like that. So if you need him to cover your wordings and your programs like that, you can contact Afri Studios, Instagram and Facebook. They are live and colored. You go to their YouTube channel you see the works of Afri Studios. So please just go there and like their page and just subscribe to their pages also. And I just also want to tell you that if you want us to advertise your brand, if it's clothing, if it is shoes, whatever, you can contact 0208 491919, 0208 491919, and we'll have a beautiful talk with you, and we can use our platform to also to let others know about what you are doing with what you like to do. Today, as I said, I have a gentleman who had been on my program before. He has come on this program before with his strength and education background and his caliber in when it comes to addiction. And I don't know, he's in the person of Charles. I call him Brother Charles. I call him Senior Charles. But I just want him to probably you are watching us for the first time, and this is Wounds of the Heart on Hope TV. Senior Charles, good evening and welcome to the program.
Good evening, boss.
Senior Charles, for the sake of my audience, can you reintroduce yourself again? Let people know who Charles is.
Okay, so I'm Charles Osei. I'm a certified addiction professional and counselor, and I'm also a member of the International Society of Substance Use Professionals. Mm-hmm. I'm also the unit head of Addictive Disease Unit, and I have some knowledge in mental health as well.
Mental health as well.
Yes.
So Charles has rattled his pedigree when it comes to addiction, and currently he's hosting us here in his yard addiction
Addictive
Diseases Unit. That's what ADU, right? That's
yes.
what we call it, right?
Yes.
So we are here at his premises. We just want to bring our studio right to him. Today I just want us to see. Probably you have seen the flyer, but
okay.
There's this drug. I will call it drug. It's a layman, and he will explain later. Called Pethidine. And you can remember some of the days I brought this young lady to share her experience on Pethidine. She shared her experience of the usage of Pethidine. I asked myself a question: why is it so prone to medical or health workers, especially doctors and nurses? The idea came that, no, let me come and meet this guy Brad Charles, who sees them and who is working with them, just to ask him or for him to tell us why it is prone, especially to medical workers, especially the doctors and the nurses. So, Brad Charles, before you enter, I want you to just a simple phrase. What is addiction? First, what is addiction?
Okay, so addiction actually is a chronic disorder, and it is composed of something called compulsion.
Okay.
When we say compulsion, is that the person, physically the person doesn't have any control of the use of the substance, and we have something called obsession, and the person has a psychological problem where there's an overpowering desire to continue using the substance, even in the presence of harmful consequences. But like you said, addiction is not only substance. You have behavioral addictions like masturbation, sex addiction, internet pornography, gambling, and others. So it's kind of a situation where the person will definitely need help.
Okay. So it is the definition you gave is that if I should hear you well, you said it's something that the person can, the edge that that person can control.
Yes. So there's this thing that we call willpower that every human being has. Okay. But when you get to the level of addiction, you don't have the willpower. You see, you don't have the willpower to. So unlike other stages before you get to addiction, you have the willpower. Even when you are abusing a substance or when you are abusing any activity, you can have a willpower to stop. But when you get to addiction, the willpower is lost.
It's lost as
the person doesn't have the capacity to stop on his own. That is it.
Okay, so when it gets to that addictive stage,
yes,
the strength for the person to say no is
not there.
Okay,
it's not there.
Okay,
physically and psychologically.
Okay, all right. So viewers, as you heard, we addiction is not spiritual. It's not.
That is it. That is it.
Once, so can you, if possible, because you have hands on the stages of addiction. How do we get to
the addictive stage?
Addictive stage.
Okay, so before somebody gets to the addictive stage, we have something we call the experimental stage.
Experimental.
And the experimental stage is when somebody has never used or anybody never used any drug or substance before, and you meet a friend, probably a party, or maybe anywhere you meet a friend, they tell you that, oh, this is alcohol, probably this is alcohol, this is weed. Try it and see. So you see, they have two people. There's a first person that will taste this alcohol or water and will not have any feeling, will not have any, we call something euphoria. When you take substances, the highness or the feeling, the enjoyment that you have, we call it euphoria. So it's possible the person will not even feel that thing, or he may not have any benefits. Unlike another person who may take it and feel like, oh, he was shy. Now he took the weed, he was okay at that particular moment, or probably has some problems at home, depression, and he took it for the first time, he was okay. So that person is unlucky at the experimental stage. Exactly. He may move on to another stage, but the one who suffered it and did not enjoy it may decide not to go again. And that person, and secondly, there's something we call genetic predisposition. There are some people whose they inherited something as they were born. The family, there is probably addiction in the family. So it's possible they have a 50% qualification already. You see, that's a challenge, and it's not their fault.
It's not their fault.
You see, so there's a family where they are drug addicts and somebody died of alcoholism. So that person may test it for the first time, and because of the genetic predisposition, he may feel like, let me continue. Are you getting the?
I'm getting places.
You see, so that person is unlucky. He goes on to a second stage where we call the recreational stage.
So experimental stage to recreational
stage. So recreational stage is a stage where it's like occasional. You have tasted it, so you know how it is, and now you go and buy it yourself. So there are a million of people who are doing recreational stage when it comes to drugs. And that stage, we say still there's no problem. Because it's like
the willpower is there for you to.
The willpower, yes, you can drink once in a while, maybe a party or a funeral, and it's acceptable. You see, but that place we call it deceptive stage, because it's possible people are not talking about it, so you may feel like it's okay and you will continue, and you jump into another stage where we call the abuse stage. So the abuse stage is a stage where, like I was telling you, in the abuse stage, there's something called compulsion, and that's the physical aspect of the disease. So the person may decide to be drinking and smoking, but mentally, sorry to say, he has something called the mental stage. Sorry for that correction. So the mental stage is the obsession. Then he has that thought to use. It's always there. Go and use. But he has a physical power where when he gets tired, he decides to stop. And that's what we call the physical. That's a compulsion. He has that power.
Experiment, recreational,
and abuse.
Now they are abusing
abuse stage. So the abuse stage, there's a challenge where psychologically he's fixated on the drug. He decides when he feels like he wants to, he comes to the mind, he goes to use.
Is it a dependency stage or
we are at the abuse stage. And he has like I was saying, he has a compulsive power. When he drink or smoke to a certain time, he decides to stop. He can stop on his own. But at this stage, they may have minor to major physical and psychological problems. You get me? And they have something we call hangover. Hangover is like a lighter side of a drawer. You see, hangover.
You know what is that?
Hangover is when they take the alcohol in the morning. You feel some way. You need to do something to either stop that thing. It's a lighter form of
withdrawal.
You see, so they have those things. Hangover. They are late at work. You start then. somebody will actually tell you at the abuse stage that Charlie, me and you they drink by your own.
Charlie,
be careful.
You get
to a stage, then you have to know that you are the abuse stage. And you yourself will come to realize that you are drinking. Now it's not once in a while, probably 3 times a week.
Okay.
And you are getting to because they are getting to the disease stage.
Okay.
You see, so from here, then here too, they still have the willpower.
Yeah, exactly.
At the abuse stage, you still have willpower.
Okay.
You can decide to stop one day when you decide that I'm tired. But if you are not careful, there is just a stone throw to addiction. And that's the disease stage. Here, there's something we call withdrawal. And withdrawals is uncomfortable signs and symptoms that occur when you decide to, when you stop without, like you are not ready and something happened and abruptly, probably maybe you are admitted at the hospital, or maybe something happened, you travel somewhere, you don't get the drugs. Then they start exhibiting some signs which are uncomfortable.
Okay.
And it depends on the type of drug. Every drug has its way.
Okay.
And some are dangerous. Something like alcohol, you can have seizures and even die. You see, so when it happens like that, it should let you know that this is the calling stage. That you should know that you have a problem. Then they have something called tolerance. Now they take, probably initially we're taking like 2 tons of hypertension. You realize that now you take about a bottle and you are still not feeling that
the euphoria,
euphoria.
You're not feeling the high.
And some start adding other things. You see, now they have, like I was saying, now they have compulsion, obsession. Physically, they have a problem. Psychologically, they have a problem. And in addiction, we have something called spiritual bankruptcy, where the person denies. There's always a denier. So when it is part of the disease.
Okay.
You definitely will deny. That's what drugs will tell you. That don't say that you have a problem. Don't tell people they have a problem, although you know you have a problem. So it is something that the disease itself will bring up to you. You are not ready for that, but so they are always denying. They have a denier. Then they cannot manage anything. They become powerless. Then socially they have a lot of problems. You see, and it goes on and on and on, and they need help.
Thanks for that short summary of the stages in addiction, from the experiment to the recreational to abuse or dependence to addictive stage and tolerance. Now you're adding other things to it. All right, then this, my viewers, in case you just joined us, we are discussing why Pethidine is so prone. Is all among health workers, especially doctors and nurses, who rather will kill us with this thing, rather turn up themselves in becoming addict to Pethidine. So yes, this is Wounds of the Heart. This is a program where we educate, we help you come out from any form of addiction, being it masturbation, being it drugs, being it alcohol, whatever addiction it is. Just fall on us, and by the grace of God and the help from other special people, we're going to give you that help that you need. All right. So therefore, it comes to our main topic. Okay. What is Pethidine?
So Pethidine is actually an opiate. When we say an opiate, it's a group of drugs where what it does is that it have a sleeping effect, and at the same time we have a pain. They manage pain. It has a sleeping effect. Yes, and a pain manager. Okay. That's an opiate. So under this opiate is a class of drug, and we have Pethidine. We have something we call tramadol. It's also part of it. We have fentanyl. We have morphine. We have heroin. Heroin is a street one. So these are a group of drugs that give that effect, and it's for pain. And Pethidine especially is used by doctors at the hospitals, and they like it because it manages the pain very well. I get to the point. So the name of the actual name of the real drug, this one is a synthetic type. It was derived from some drug, and the name of the actual drug is called morphine. Morphine, okay. So around 1943, that way, there was one doctor who came out with Pethidine because they realized that the morphine, that was the original drug, is causing a lot of havoc. The same way Pethidine is causing us now. It used to be addicted by people. People were using it, stealing it. People were dying out of it because they were abusing it. Yes, that was morphine. Initially. So in 1943, there's somebody, even in 1939, somebody who came out that, because morphine is a problem, I've come up with another. But they forgot to know that it had the same properties. You get me? So from 1943, it was actually patented that it should be used, and they started using it, and it was good. But people realized that even the Pethidine is better than the morphine, and they started getting hooked on to the Pethidine. So it's a problem that has been, and that because it's used at the health section and its availability, the health personnel, that's what they are close at. In case, though we have health personnel that are addicted to alcohol, marijuana, those things, but the one that stands out is the Pethidine. And what happens is that it's available, and they are always getting it. Then if they got the drug of choice nearer to them, you get
so the
it.
Pethidine is an opioid.
It's an opioid, yes.
Okay.
Yes.
What is the difference between Pethidine? What are the differences, Pethidine and tramadol?
They have the same characteristics because they are the same. Just that, let's say that the Pethidine, the tramadol probably may be on a lighter side. Are you getting the point? But the combination, now you know that if somebody is addicted to Pethidine, it's not the normal tramadol. It's not the normal tramadol that we use. It's the street one. They have one that is about 200, 250 milligram, not the 50 milligram one.
You said when you were talking about heroin, you said the street one. What is the street
heroin? One? Heroin, like I'm saying, Pethidine is a prescription drug. And it's used, it's a prescription drug. You actually have to prescribe it, and it's used at the hospital.
Okay.
So let's say that one is the one that is used.
It's not an over-the-counter medicine?
No, it's not over-the-counter. A doctor actually has to write it for all these years because of how it is misused. So we say that it's a prescription drug, and it's sold at the hospital. But there's actually people who use this same, that is like the Pethidine, that same class, and it's called heroin. They don't have it's not available to them to go and buy the Pethidine. And what the heroin is, that one they smoke it and they chase it. But it has the same characteristics. Like I'm saying that we have depressants and we say alcohol and probably Valium and those things because they all have the same thing. Just that this one, the street person will not use the Pethidine because he knows the heroin or tramadol.
Okay.
So that is it.
Okay.
But the same group.
Okay. So tramadol too is an opioid.
It's an opioid.
Okay.
Yes, it's an opioid.
And it's prescribed.
It's also it's also prescribed. You see, just that people find their own way. Like the Pethidine, people find their own way and buy it from the black market. Yes. Yeah.
Money black market, medicine to black
medicine.
Market.
We have the black market. That's what we have.
All right, viewers. In case you just joined, I'll just laugh. In case you just joined, we are discussing why Pethidine is so common when it comes in health workers, in health workers, especially doctors and nurses. And Bro Charles is telling us about the fact that it is there at the hospital because they are the ones who prescribe it to the patient. So it is there. Why can't? So how do they become addicted to Pethidine? How? What is it? What makes them addicted to Pethidine?
So what happens is that like I was telling you, there are a lot of reasons why people start using Pethidine per se. So for the people that I have worked with, and I have I probably counseled, what I normally see is it normally starts with the pain. People come with, it normally starts, if it's a genuine pain, probably how they started. We have these ladies with painful menstruation.
Okay.
And they may be taking Buscopan and other medications, probably because they are working in the hospital. Maybe it will dawn on them one day that, this one I'm using for my other clients, let me just try. So that's the experimental state for them. And it's possible maybe a colleague may into it. So the pain also comes with, some of them have chronic headaches.
So the causes that's what we're discussing.
That's what some of the predisposing causes. And some of them like migraine. So it's a genuine something that starts. And they may also maybe using other substances, and probably somebody will say, Pethidine is good for the pain, and they start using. Then we have, like these people that have, like these health workers, most of them also complain about stress. Sometimes they are stressed that they go for nights and they have to sleep and call for again. So they totally takes it, and that's how it also started. And there are various reasons. Like I'm telling you, some people are genetically predisposed already. So probably in their family.
Pethidine.
Yeah, because it's a drug. It applies to all the drugs. If you are somebody in your family that probably there's an alcohol problem in your family, and you decide not to use alcohol, but even go and use weed or Pethidine, you definitely will become an addict soon.
Because there's an addictive trait.
There's an addictive trait. It's not about the particular substance. It's about any addictive substance. Are you getting the point?
Then it's better you don't associate yourself because you may not know that.
So if you know that your family have a predisposition, you don't even start.
Even if you don't know, you don't start at all because you may not know your
drugs are not meant to be misused.
Yeah, your grandfather or your grandmother, somebody in the line may have used any form of
Yes. So drugs are not meant to be smoked. I told you the other time that drugs are. It's just that we human beings have decided to be smoking and drinking and doing those things and injecting it and misusing it because they are all for medicinal purpose and other textiles and all those things. So everybody has to. They say there's no excuse for. They say there's no excuse for the law, and ignorance is
no excuse.
Ignorance is no excuse. You get me? So that is what we have to look at. We are praying that nobody even starts using them, so that they become addicted. You get the point? You see. So we were on the courses.
Yeah, exactly.
So apart from that, there are some people too that, apart from that, they may be having some other, marital issues. You get me, and probably
so marital issues can also bring.
Some confusion or depression.
A health worker.
Yes, probably depressed, and that is it. And probably getting something to cool her down. You get me? Thinking that after that she will stop. She may not be thinking, but after using it, you start thinking the following morning. That's what they have to do. And a whole lot. If you talk about the predisposition, then we can go to probably
go there. We are talking about why
probably people have
our nurses and doctors.
Yes. But particular about the nurses, normally is this one. I know there are these people too that sickle cell crisis. So sickle cell, they are not. So those who are health personnel and have sickle cell, you see, they are also keen of getting the drug. You see, but we have some people too who are not health personnel, but they are sickle cell patients and they use it. You see, they find a way of buying it or even learning how to inject it. Because they are not health personnel, but they find a way. When you become an addict, you are smart. So they find a way of doing it, and it's like I was telling you, it solves their pain. It solves their pain. To be positive, if you solve their pain, but when you abuse it, it will kill you at the long run.
So the lady who came on the show last 2 years, she's still a nurse at the with the how do you call them, those in the mental
mental health challenge people.
Nurse, and she was also a sickle cell.
Okay.
So as you saying, drew my attention to that she come to Kolebu for them to inject.
Yeah, that was a genuine one.
Genuine, but she met someone, a pharmacist, who said, and a whole nurse there, why do you come from where she stays into? It's far. Then why wouldn't you? So she
started going.
She had that thing with the guy, and the guy will go behind the counter, and to the extent that she went to steal.
And there was,
she goes to the counter, watch and go back and steal the medicine. At the point in time, it landed her at the cells. Counter back. Even the evidence crash, she told us she stole the evidence at the cells. So that is how far becoming an addict to a particular drug can lead us. So the causes you may mention are probably pains, genuine pains.
Yeah, started from genuine pains.
Genuine pains that we know it is genuine. Stress or depression among health workers because they've been overworking sometimes. You call them and the work doesn't give them the chance for them to rest. So they will take that to sleep because after all, especially when they are off duty. And also people with health workers with issues in their home. Issues. They want to just, Master, let me mamin rest it, maminda. Then the wife or the husband may not know what he or she has taken to sleep. And also there are nurses who are also sickle cell who are sick of menstrual pains and stuff like that also may cause them. But if these are the causes, what are some of the symptoms for us to know that this health worker is using Pethidine?
So what happens is that the other drugs, like maybe alcohol, they use it with people. So you will know that at least somebody will say that I saw you drinking the alcohol. You see, but when it comes to Pethidine, it's kind of it draws in secrecy. So when the people start, it's difficult to find two people using together. It's normally secretively done because of how it is injection. You see, it's weird. People see it and they'll be surprised and they'll be afraid. So it's normally done. So what happens is, number one, you realize that they have something we call, there's this kind of sleep. That is not a normal sleep. It's between consciousness and unconsciousness. Like the person may be going off and comes back, and he just comes to normal. And you just be watching around to see. So we call it, in medical terms, we have a nickname for it, and we call it sweet nodding. You see, so this is one of the things that make them so that it's like in between unconsciousness and conscious. Like we are going off and you come. So if I'm talking about heroin, it's the same thing. You see the street guys in America and elsewhere, they'll be in the corner and they'll be sleeping and they'll be waking up. And so that one is like Pethidine, but that's heroin. You see, and that one, they can even, some of them who know how to inject the heroin. But it's not done in our part of this world. In abroad, they do it. So that's the characteristic this thing that you see. Then apart from that, you know that injection marks. If you are very this, you will see that there are injection masks around them, and some of them even, you know, there's a cannula, the one that some of them can even put a cannula. Those who don't want any problem, like now that you are going to look for your vein, or probably those who do the vein, because let me tell you, there's a vein one.
Charles, no, Charles, okay. You are teaching me something.
That is it.
People about if their family members are health workers, these are the things they're going to start. So that at least they may draw attention. So the two things you're going to say.
So I'm saying that some of them can put a cannula
yes,
on them permanently. It's sitting somewhere, so that when they get the drug, they just push it through. So if you should be very observant and be watching their things. And when you watch inside their bags, you may be seeing syringes. You know, syringes that they use to.
But so a nurse needs, so why do you must
but unlike before, initially they may not be, because you see that even in their room, everywhere, they will be hiding it. So that's how you need to search. Definitely you will come across it. You see when they start using, and you see blood stains. Because of the injection, some of them you may see blood stains. They may be unaware. Because they may inject, and you know when you are using drugs, sometimes you are forgetfulness happens. So you may see the blood in there. It's not one or two times. They may deny and tell you that they are sick and all those, and they live secret life. Originally they were okay. They come to you around the house. They are everywhere, and when they start, they are secretive. They are always reserved and isolated.
Okay, so in case you have someone who is a medical worker, especially nurse. The doctors, well,
no, let me tell you, the thing is doctors, nurses, pharmacists too.
Okay, so
okay, and even so lab people.
I wanted the lab people today.
Yeah, it's not only now. We do the admissions, and I'm telling you that it's not only.
I won't challenge you, but
it's not only nurses.
So then I was right saying among health workers.
Yes, that's the health workers. Health workers.
So if you have someone who's a health worker, and that person start exhibiting what we are saying. If you see marks, syringe marks, panier, I say I want panier bebre, you see that thing. Don't just close your eyes on it. Blood stains, kakra said that the bed sheet, let us be mindful about that. And also if that your friend, your wife, your husband, your sister, your brother, who is a health worker, pharmacist, lab technician, nurse, doctor, whatever in the health field. So if you are drawn, if that person start to lay a back, now he doesn't put himself through things that actively he used to or she used to, then these are some of the things we need to watch. We will pause here. We'll come back. We'll come back to continue with the signs and symptoms for us to also know, so that we can help our friends, our loved ones, our brothers, sisters who are health workers who probably may be abusing or may be addictive to Pethidine. And this program is Wounds of the Heart, where we're here to help you heal any form of wounds that have been caused by all things that we are discussing here. I'm with Brad Charles. He is in charge of ADU at Kolebu Hospital. So I'll be right back. When I come back, we're going to continue with our signs and symptoms of one who is using or who is abusing Pethidine. Please don't go anywhere. I'll be right back.
I am an angel of hope.
I'm an angel of hope.
Ubrenio, so do Sika a beba boho channel. No, so ya sene. Yet me the mere some a main she saw in Chorum Yana, Wadaroma, Farmain, Nafa Sika Fasubi. Na also fabra yenko kanyamsem enya kra ewunkwa *928*34*104# anase 0249193083 Hope Channel yes sabrabo Hope Channel ye gia kra no nkwa.
Today we think that Christianity is just some sort of a jacket we put on and we get home and then we take it off and all of that. If Israel had felt so comfortable in Egypt, would God have gone to deliver them?
God will not come to redeem a people who have themselves adjusted their lives so much to this world.
Without oppression, without tribulation, without trials, there's no need for deliverance.
In this new series of our Bible-based conversations, we are looking at the examples and the experiences of the children of Israel in their journey from Egypt to Canaan, and how this mirrors or parallels our Christian journey, even as we await the second coming of Jesus Christ.
The journey Egypt to Canaan experience and its essence to us today. Showing this and every Saturday at 6 p.m. only on Hope Channel Ghana.
Every individual has a story. Stories of social issues such as infertility.
You did not marry your wife only because she's going to give you a child. You married because you loved her. Whatever comes on your plate, you're ready to accept that.
Abuse, obesity, life struggles, and others can be very frustrating. That is why Real Talk is back again with another exciting season where individuals like you can come into our studio or join us virtually to share your story and experience. To share your story, you can reach us through our WhatsApp number at 0559 680 066, or you can email us at hoptvghana@gmail.com. We say don't lock them away. If you ignore them, they can just get angrier and louder.
All right, so welcome back from the break. Thank you so much for staying with me. In case you just tune in your TV set to Hope TV, we are discussing why Pethidine is common among health workers, and we want to help others. So please, if you have any comment, any question, any contribution, you can send it on our Facebook page and we'll have time to read, or on our WhatsApp platform. We're also 0559 680 0559 680 And if you have questions, if you have somebody you need help, you need us to help the person, please just send me your name and your contact, and I'll give you to people like Charles who are vested in what we are discussing, and they can take you through the process for you to overcome whatever addiction you are going through. So instead of, if you have a question, you can put it there. If you have a comment, you can put it there. And if you also have gone through this before and you want to share your experience with us, you can also put your name there and your contact. I'll call you for discussion and we'll see how best. If you don't want your face even to come, I will know what to do and we'll record you without even showing your face. So please, for the sake of stigma and for the sake of stigma, that's what we're going to do. So please, if you have that thing, we'll be very glad to listen to you. And also, if Wounds of the Heart has really helped you, you can also contact the same line 0208 491919, 0208 491919, or 0559 680 Our WhatsApp, all these lines are WhatsApp, and we will have time to talk and we'll see how best we can record you as well. It gives us motivation to know that our program it's also helping people out there. All right, so Senior Charles, we went out when we were discussing some of the signs and symptoms, and he told us that they are secretive, they withdraw from normal gathering as they used to. They will see syringes. Somebody will ask what is syringe. In Pania near the wall, in Pania,
they don't sell syringes
in their staff, in their rooms, and it's not because they are doctors. We should raise concern about it, and also. You see blood stains, sometimes blood stains. It's not a mosquito stain, but then a blood stain in their dresses, because sometimes those addicts are not, they are forgetful, as you say. And also you say you see syringe marks.
Yes. On their
Aside this, what else that
okay, so there's a tendency for them when you start using Pethidine, you see they like sweet things. So they don't eat much. You know that they take toffees. You see them taking toffees. You know, things that are just sweet. So a lot of toffees with them. And I mean, you know, those things. So you see that they were not doing that. But they'll be buying toffees, candies, you know, cake, you know, sweet. When you start using them, you have that love for sweet things. Yes, you have an appetite for sweet things. And aside that, when it comes about eating, you know, Pethidine itself is an appetite depressant. So when you take it, you don't feel to eat well. Okay. So they don't normally, so they lose weight. You may know her, and when they use for a long time, you see them and you'll be surprised. They would have lost weight drastically. You get me? So there's some of that. When they start initially, you may not see, but with time, they continue to the level of addiction. You realize that they have changed. They will not be the same way that they used to be. So that's one of the things. And apart from that, you know, the abscesses. Some of them before they come for you know, the procedure for counseling, they may have abscesses, which said some of them go admitted at surgical units. And
what is abscesses?
You know, because of the injections. You know, what happens is that when you start injecting, you know, we have two types. I was saying we have the IV one where you pass through the vein. And we have the one that is the IM. Then we even have some people even do subcutaneous. I even met a client subcutaneous under the skin. Yeah, some people try that one. And I've even met, surprisingly, I've met one or two people that take it orally. You know, they take it orally, they drink it.
All the friends
you see, you know, the thing is that those people that were doing that, you know, the explanation was that, you know, they were being monitored. You see, and they were being monitored by people. You know, they were taking somewhere where they were being monitored, and they need to.
So like they were experimenting whether or not if they don't inject.
It's not that whether or not. You know that when you're having a withdrawal, that feeling that is uncomfortable, and you don't have the means. Probably they put you somewhere, but you have it, but don't have the needles. So they decided to drink it to see whether at least it will help even make the withdrawal. Because they want the thing in the body. Just that this one is not drunk, but you know that at that critical moment, the person has it, but doesn't have the syringe, so he drank it. And it worked for the person. She was telling me that it worked for her. So it's surprising. When you work in an institution, like some of them, you know, some may be theoretical, but practically we see things that should be written now. Because I met some people who actually drank it, and they were telling me that the withdrawal was so much and they were being monitored. So they had to do that. You see, so some people go to that level to drink something that has to be injected because the withdrawal was too intense. You get me? And that's how bad it is. You know, Pethidine is a hard drug. You know, and it will surprise you that it doesn't take that long to be addicted. Unlike alcohol, that somebody can be using alcohol for like probably 2-5, some people even 20 years. You know, alcohol. Somebody can drink alcohol until you get to your addiction level. It takes a long time. But Pethidine is a hard drug, like cocaine. So nobody, don't tell me you can't use Pethidine for like probably a month continuously and say that you are doing recreational or you are past that level because it will not get long.
No, all addiction takes stages, like from the experiment as you are saying to tolerance. But with Pethidine,
it's very short. Let's say that if alcohol should take like 2-3 years, 5 years,
for you to be addicted to alcohol,
Pethidine, if continuous using like a month, you get there. You get there. That's how it is. Because it's a hard drug and it's the effects are enormous. You get me? And when you start using it, there's a tendency for you to continue. That's how come you don't start using those substances at all. You get me? So like you were saying, people are, now you also forgot to add this one, victims of treatment. You see some people are victims of treatment. Like he didn't intentionally go there, give me Pethidine. Probably he went to do a CS.
And they
injected. And you know, some people come for surgeries, like hernia and all those things. And the doctor, you know, some of the doctors, they are challenged. Because, you know, as for doctors, they do this. It's an emergency drug, are you getting me? And nobody will prescribe Pethidine more than 48 hours. So after theater, you realize that there's a brochure that they write that probably 4 to 8 hours hourly, 24 hours, some 48 hours. So it is meant that this drug should be used there for 24 hours and the person will be fine. You see, but when somebody is addicted, when somebody is addicted critically, you know, the person can use about 20 of the ampoules a day and he will not even be okay, you see, because he's addicted. You see, but 20 and 20, let's say 400 milligrams is about, you see, the 1 ml is 100 milligrams. So in the whole day, you shouldn't use more than 400 milligrams, like the one that doctor has prescribed, like 4 hours, you see. And even for people who have cancer, when they prescribe for them, because serious pain and those people, you don't have to exceed that one. You see, but the one that is addicted to may use about, let's say 10 ampoules is about 1,000. You see, that person may use it and still will fall for, because he has tolerance. You don't have the tolerance. And it's possible. So you know that, and that may lead to overdose and all those things. So it's a drug that, you see, me, my pain is that, from my experience, you see, I've realized that Pethidine likes beautiful and handsome. But all the people that are addicted, if you see them, they are well-to-do people, very intelligent people, you get me? And when they get hooked up, most of them are very intelligent and nice people. You see, and it's not like, and one fearful thing about it is that you ask yourself that you are health personnel and you know about all these things. So why? That's addiction for you. You may know everything in this world, but when you start it and go through those stages, you definitely become addicted. You see. So for that one, it's a mystery. It's a mystery.
Viewers, I'm so in my seat because it is something else for our doctors, our nurses, our pharmacists, our lab technicians, whatever in the health field. In as much as they are there for us, they are trying to make us fine when we come. We'll rather also be addicted to things that may also take their lives one way or the other if the person could not stop using it. And it is something else. If you just join the program, we are discussing why Pethidine is common among health workers, and he's telling me, he's telling us why it is so common, the usage. It's prone, they see it in their hospitals, they see it in their pharmacy. And you know that this Pethidine is an opioid, and it's not over the counter unless it's prescribed by the doctor. And if the doctor himself will prescribe and still will also use it, then I think that it is you and I, it's our duty also, those who have strength, who have the willpower, to also help people in that regard. We shouldn't say that because they are doctors, they are nurses, they are whatever, and health workers. We shouldn't assume that they know better, because addiction is no respecter of people. It doesn't, because there are pastors who smoke before they mount drink because they said the crowd and stuff like that. So if you get me, so please, I think that it is our duty, this program is our duty to help raise those red flags among people in that institution, so that at least you and I can also help them out. But in all these things, Charles, what are the effects of Pethidine in the life of a health worker?
Okay, so some of the effects for me, normally I want to start with the social effects, because you know, financially, it's a big problem, because you know, most of the health personnel that come for you know, for the counseling and for rehabilitation, you know, the price of the drug is so expensive. You know, I was telling you that there's a street one that people sell in the black market. So initially they start from the hospital. You know, sometimes you get a patient one or two from the patient's this thing, but you know that because of the strict adherence to protocols, how to get a pet, you know, they have a GDA box at the hospital where they keep it, and there's a key. You know, some people write prescriptions, they start like that, they write prescriptions to the pharmacy to take it, you know, some, you know, one or two people will take it from a client's, you know, things, you know, and it comes to a time that now everywhere is blocked, and now you have to go to the streets. And as I'm telling you right now, for the Pethidine, like they tell me now, is about 80 Ghana for one. For just one. There's the one that is that's 100 ml.
The one ampoule,
yeah, one ampoule is about 80 Ghana. So can you imagine? And you know what? And somebody can do more than that, you see. And imagine that. And what happens is that the person needs it. So what they do is that they owe everywhere, and they manipulate people, collect money from people, and some of them do weird things. You know, they can. Some of them use their money that they even pay to them for loans. So you see somebody, he doesn't have anything. Before they come for admission, everything is done. You see, that's one of the things that make it so painful. And you see somebody sell his properties. You see, so you can equate it to like cocaine and, you know, the hard drugs, the heroin, like I was telling you, it's like that. And it could be even more than that, because you can sell everything. Imagine that you have to do 20 a day. And let's say one is 80 Ghana, if you should do the calculation now. Imagine. So you, one person, they use about 2,000 a day. And where are you going to get that money from, you see? And this is one of the things. And secondly, the family becomes so confused. It affects the family more than the client because
Exactly.
number one, they don't understand. They know about alcohol.
Yes,
they know about weed.
alcohol.
But you say my daughter or my son is using so they become so confused, and some even go into depression, and you know some even dissociate themselves from the client. You see, so socially there's a big problem. Apart from that, you know, some psychologically, some get, you know, this suicidal ideation. Some we had like last year we had 2 deaths.
Oh.
Last year we had 2 deaths, 2 females. One from, I think, Konfanochi, and there's one from Mamprobi Polyclinic.
Nurses?
Yeah, nurses, 2 females, you see. And even over the years, we had some deaths that were not recorded, you see. But recently that they started recording them. So it has been there with us. And
so what was the cause?
You see, there was one, the suicidal one was one that has been using for a very long time. And you know that, like, you come to that one, when you say God Pethidine is a downer. It's, you know, it's a downer, it's a sleeping one, it's a depressant. So it makes you get there, you become depressed. When sometimes you don't get the drug, it makes you have those mental health problems. So I think that's one of the things that made her, she was confused and tired in life. I think the other one, there was this administrative procedures that were not working too well. You know, for Kolebu, if you have a problem like this, for me, I write letters all the time, you know, to ask an advocate to help my clients that they are sick. Because nobody dismisses anybody in Kolebu when you have a Pethidine problem. Once I am there to talk for you see, because it's a disease.
So once somebody have come to the hospital,
we need to make sure that his money is coming. He comes to the clinic. Once he comes to the clinic for treatment, you don't take the pay. Every time it's coming, and by the time they are fine, they use their money because they are sick. It's not that they are bad people.
It's not that they are.
So that one, there was some administrative flaws, and I don't know actually how true it is, and that led to the lady became so confused and they committed suicide. So it leads to suicide as well. You get me?
Yeah.
And the abscesses. Like I was telling you, you know, we had about 1 or 2 clients that got amputation because of this. We have been using it, and they had abscesses. Now it went off. Now the limb had to be taken off. You know, because it was so bad. They lost the limb. You see, and you know, you can have a total organ failure when using Pethidine. You see, you can have an overdose and die. You get me? And there's a whole lot. They have heart problems. You know, some of them, there was somebody that had, you know, he had this permanent seizures, you know, because of the brain effect. You have permanent seizures, and even after using, you have to be taking medications for a very long time. If not, you are not careful for life, because it becomes violent. You get me? And the veins collapse. Some of them, when they come and you want a vein to do detox, you can't get a vein because all the veins are collapsed. You have used all, and they have become flabby, and you can't find them. When you get them, it doesn't go through. You get me? And there's a whole lot. You see.
Yeah, there's a whole lot. So how do we help them? How can we? Because they are doctors, they are nurses, they are pharmacists. Who are we to? So how can we help if a family member we have seen this signs that he or she is through that? How do we help them?
Okay, so the help only comes from, you know, number one, the person to, you know, what we normally want is that the person should be ready to stop. But if the person is not ready, and the relatives know that this person may die, normally they will not accept that they have a problem for that one. Substance use person will never accept. So what happens is that you need to bring them to like a treatment center, like a place like this. You know, Kolebu has the outpatient treatment. We don't have a residential facility, so we have an outpatient. We do detox as well. So what they come, we do assessment, and what they need initially will be a detox. And a detox, let me tell you the truth, that a detox is just about 5 to 10% of treatment. So when you come, detox will just stabilize you. Make you easy, because they have something like I said, the withdrawals. If they are not able to pass through the withdrawal, and you said they should come for treatment, they will come and be disturbing us here, because the withdrawals are there. They will not concentrate, they will not listen to anything, but they need medical detoxification where it makes the body feels okay, so that those withdrawals, those symptoms that they feel like they become aggressive, they are not okay, they have headache and all those things will go away. And that is the beginning of treatment. If they don't do that one, it will be difficult for the counseling. But if they do this one and they do the counseling, it's zero. You see, most people think that you do detox and just go away. But you do detox, you have to work on your brain. And that's 90% of what you have to do at the counseling. So you need that one, whether residential or outpatient, you need the counseling. So this is what we take them through. And when they come here, we take them through a whole lot of things. We use CBT, cognitive behavioral therapy. We motivate them by doing motivation enhancement therapy. We do the contingency treatment, a lot of things we do. And we do the 12 steps as well. Okay, you see, then we take them to recreational therapies, you know, and give them assignments, and a lot. That's what we do them. And the family section is also very important. Every Wednesday, we talk to the family, because the family are confused. And they are a problem. The client is even not a bigger problem like the family. You see, the family will come with their problems. We need to also counsel the family every week. They will call you every time in the evening to tell you what is going on. He has gone out, he's not contributing. You see, so we do referrals. When you come to the outpatient and we feel like you are still using, because we do the screening. We screen them every month. We do them every month screening. So we screen you, and if it's still there, that means that it's not working. The home environment is not working, it's not helpful. So you have to go to
a rehab.
And the challenges are there. I told you about the cost of the rehabs. It's expensive, and you know, it's a toll on the family. And you know, when you see a person that has this full-blown disease of addiction, and you know, because of our experience, you look at her and you feel so bad for the person. And if the person is not ready, the family too is not supportive. You see, and at the end, most of them, you see the end of them, and it's very bad. You see, it's very bad. What we normally say in quotes, we don't say it now, a junkie. They become like them. You see, so you see a female that is a nurse, or a male or female that is a doctor that has spent a whole lot of money, 7 years in medical school, has done other things, specializations, and you see that the end of the person is so bad. Like the person on the street that is taking heroin and all those things. And you know, there's one funny thing in this books that we are learning. There's one, he says that your enemy, even your enemy will not wish addiction for you.
Yeah.
Even your enemy, because the enemy, if the enemy knows that this is how addiction is, they would have cursed you that you should have added than to die. So that you suffer everything. Because exactly. Addiction, my brother, addiction is worse than, it's death before death. If you are not able to work on yourself, it's like you die before you die the actual death.
You die physical,
you die living.
Social death.
You die psychological death, medical death. Before the actual death. So it is something that for us, we pray that nobody gets there. Because you know, there's one thing about, I always say this when I go anywhere, sexually. You see, when you are a male or a female, this one goes to everybody that is using and has died not to stop. You have difficulty giving up birth because it affects Pethidine affects female and male. You know, the reproductive affects. So you may be looking for a baby or something. You are
still using Pethidine.
Yes, and if you don't stop it, when you stop it, everything corrects itself. For the male and female, it's something that people don't know, but with research, I have seen that it is one of the things that you may think that you are not fertile, you are not this, but the Pethidine itself
it's causing that
thing. One of the things that it does.
Then if you're a health worker and probably giving birth has become a problem and you know that you're using Pethidine,
you should stop it.
Stop.
It's one of the things that blocks you.
I'm hurting, or stop hurting your external family, stop hurting your in-laws, and stop hurting your husband or your wife.
It's one of the things.
As he's saying, it's a cause of infertility.
Yes,
so I think that. So Charles, before we wrap up, what counsel will you give to families whose members, doctors, their daughters, their sons are medical workers, health workers, but then are addicted to Pethidine?
For me, what I would tell them is that they should have 100% tolerance, because it's a difficult situation to be a part of somebody, especially if it's a husband or a wife. Those are very close to them, the external family as well. And because you know what happens is that people even want their relatives to be addicted to alcohol than to Pethidine, because they see that it is so weird. That how should you be injecting yourself? That means you're a wicked person to hire somewhere to be injected. They don't understand. It's a mystery to them. You see, so they become so. They think otherwise. Some of them think about probably spiritual intervention. You know, go elsewhere. You know, because of the severity of the thing, they don't understand it. So I'm telling them that it is just a disease. You see, and we have people that are free from using when they need those, you know, our procedures of treatment. They followed it. It worked for them. So they should just think about helping than to think about other ways or other causes of it. It's basically a disease. And I tell them that if they follow what the therapist tell them, they will do. We have examples that are working, going back to work, and their families are happy because they follow the procedure that we told them. Because they passes places. People come here, they have gone to a lot of places, it doesn't work, and before they come, the person has gone some chronic condition already, and that one, what are you going to do then to help for cancer? But you have a chronic condition, you see. Because we have people who come, like I told you, amputation, but they delayed, thinking that it was somebody that was doing, and they were going to other places.
Thank you, Charles. Viewers, this is where we're going to end our discussion. Pethidine being common among health workers, and I was soaked when the causes, the effect started flowing in, and it will be unfortunate for someone who has spent all your years in medical school, brilliant, brainy, and or in the nursing field, and the pharmacist also, or the lab, and all these monies that you have gone on, and you come back in working and you become addicted to Pethidine. It doesn't make meaning psychologically. So I think that yes, you can't be forced to change or to stop, but we are pleading with the discussion we've had that if you are into it, own up and seek for help, because you know that it is not good. You know, because you're a medical doctor, so you know. You are a nurse, so you know it is not good. Own up and let those in charge take you through the system, so that at least your money financially will be sound, and your family also would have that beautiful relationship with you. Charles, thank you so much for your time. We'll come again. We'll come here again. I'm sure whenever I come here, your doors are already open to receive me. And viewers, thank you so much for also being part of this program. And thank you for your messages. Thank you for your prayers. Thank you for everything that you have been doing for Wounds of the Heart. As I said, if you want us to advertise your product, please, the number to call is 0208 491919. 0208 491919. And when you call, we'll talk to you and you see how best we can also insert your product as part of our program, so that at least it also will sell everywhere people are watching. Because Hope TV stage, it goes far, not in Ghana alone, but outside Ghana also people watch. So if you are a designer, whatever you are, please, let's talk, and we'll see the way forward. If you have concern, if you need help, and if you want us to also give you help, the same number, 0208 491919 or 0559 680066, 0559 680066. Your name will do. And if you want to also to sponsor my program, Wounds of the Heart, if you really want to sponsor, because it's expensive, I'll be very glad if you really want to sponsor this program. Whatever you can sponsor it with, please call my number 0208 491919 and let's talk. God bless you for being part of our program, and all those who watch today, God bless you. Please share to friends and loved ones who may be going through this issue called Pethidine addiction. God bless you. Until then, I've been your regular host, and the name is Pastor Daniel Abedu Bidiaba. I'm out.
Hope channel is my favorite Christian channel. The best thing about it is that you can have it everywhere you go. All you need to do is to download the Hope channel app on your Play Store or Apple Store and get all the programs you want to watch.